This is a serious problem because we have noticed this in Guinea, that no matter how the government advise people to take some measures, people tend, by tradition, by for cultural reasons, they want to take care of the dead body. They want to, when the person is infected, they want to take care of the person, but we are trying to overcome that. This is one of the measures actually taken by the government, that when there is a case, the family should stay away and let the medical personnel take care of it. So, but it's a very big problem. This is why I'm going to mention that right now, that we should make sure that we train local doctors, local nurses, and family members to how to deal with the people affected, because they can explain to them, to the family, those local medical personnel can explain to the family that this is not an imported virus. It's not planted by the international community, but it's a real disease that they should cooperate. They should cooperate with the medical measures that have been proposed to them. Since the outbreak, the government has been extremely concerned and has taken a lot of measures, many measures to prevent the Ebola from spreading. As you will recall, in Guinea, it started in the forest region, and the government, together in partnership with Médecins Sans Frontières, World Health Organization, WHO, they have cordoned the areas in order to be able to contain the spread of the virus. And there was a meeting, a summit meeting in Conakry on the 1st of August, whereby the head of states of the Mano-River Union agreed on a specific declaration. Among the measures in this declaration, the need to put a cordon, to put in quarantine the border region between the three countries, so as to contain, because it's in that area that 70% of the patients or the infected people are. And they have decided that the Ebola outbreak a crisis is not just an health issue, it's also economic, security, humanitarian, because when you cordon this area, you have to provide them with the means to live. And so this is basically what has been done in Guinea. Plus, recently, on the 13th of August, the government decided to decree a health emergency, a state of emergency. And that has helped a lot, because there's more medical checkpoints all over the country, so that to ensure that people who have contacted this virus do not travel all over the country. So now, in our view here in New York, we are trying to galvanize the international support for this, and to make sure that all the efforts are coordinated, because we don't want the initiatives to go in every direction. And one key thing also about this is to use the final declaration adopted by the head of state as the basis of any strategy that the international community is planning to undertake to control this disease. I had a meeting with the new coordinator of the UN system, Mr. Nabarro, and I explained to him this need for coordination of the international community's intervention. And he agreed with me, and also to make sure that parts of the resources, the financial resources that are going to be collected part should be used also to help alleviate the economic, the humanitarian and social consequences for these people in that region. He agreed with me on all these points. Now we are today in a meeting in this forum, New York City Forum on Ebola, and we want to make sure that the NGOs intervention, we welcome them, but we want to make sure that this coordinated, their intervention is coordinated, and to make sure that we help those countries with the necessary capacity building. For example, the medical centers and the training of medical personnel. All these are important key that we should keep in mind and target these areas.